For you guys who remember, I'm Dr. Mike Penson Stadler. Just call me Dr. Mike. It's a lot easier, and I really don't want to be known as Dr. P for obvious reasons. So thanks for everybody who's come here, and thanks for everybody who's joining us online and live, and for anybody who is seeing this and they want to view it again, we are taping this, so if you can log in on our website or on our Facebook page and also our YouTube page, you can look at these videos at those places if you want to review it, or if you have a friend that missed it that they would want to view it as well. Today we're going to be talking about heart disease in dogs. Now this is a big subject. When we first started hearing input from you guys about what you guys want to hear about, heart disease was one of the top ones that we had seen, and in dogs and cats. But it's such a big subject, I decided to divvy it up a little bit. So we're going to concentrate just on dogs today. In 2 weeks, on April 9th, the same time, same place, we're going to be doing on cat heart disease at that one. Okay, so we're going to separate it out. And even though I'm only focusing on dogs today, it is still a big subject. My last seminar, I went on a whole day's worth of cardiology lectures, 10 hours on the information I'm going to be giving to you today. So I'm really going to be condensing things down. And as a result, we want to think of this lecture more as just a bird's eye overview, a helicopter view to see what the general terrain is of heart disease in dogs. It's not going to go and delve into a lot of the nooks and crannies. If you guys want to stay after, I'd be happy to go as deep as you want, because I really enjoy cardiology. It's one of my favorite things to practice in veterinary medicine. But I just want to give you an idea and a perspective of what we're going to be covering and how. Now, if you guys have been to my lectures, you know that whenever I start these things, I always like to start at the beginning, which means in order to know what is abnormal, we first have to know what is normal. So I'm going to a couple minutes to show you what a normal heart does and how it works. And from there, then we can launch into whenever it becomes abnormal. Now, this is a heart schema where on the left side, we have the heart in relaxation called diastole. And over here, the heart in systole, which is contraction. Okay, when we talk about relaxation and contraction, we're talking about the ventricles. Now let's look at the left-hand one here a little bit first. Now in the heart, there's actually 4 chambers. You have the right and left atria, then you have the right and left ventricles. For some reason, always in convention in veterinary medicine, we put the right side of the patient to our left, just always backwards, so kind of remember that. Now whenever, the way the heart works is these 4 chambers work so that the blood from the body comes from the top, the head and the rest of the body to the left or to the right atrium. Blood flows from there to the right ventricle. Now, in order to keep the blood flowing in the right direction, there's a valve here between the atria and the ventricle, okay? So then whenever the ventricle contracts, it then closes this valve. Now the blood flows into the blood vessels that go to the lung, called the pulmonary arteries, okay? Once the blood is in the lungs, it gets aerated, and then it comes back to the left atrium through the pulmonary veins. The left atrium fills, and then it contracts, and then fills up the left ventricle. Then when the left ventricle contracts, the valve here between the atrium and the ventricle closes, and then the blood flows out through what's called the aorta, which pumps the blood to the rest of the body. Okay. Now, even though I focused on here just to kind of give you the general anatomy, really the heart is 2 pumps acting in one. The right side of the heart is 1 pump, and the left side of the heart is a 2nd pump. And they work in unison. So both atria, they will contract at the same time to fill both ventricles. Both ventricles contract at the same time, with the right side of the heart pumping blood to the lungs and the left side of the heart pumping blood to the rest of the body. Now, in order for the heart to work properly, it has to be having normally functioning valves, normally functioning heart muscle, and the heart has to beat in a rate that is going to maximize the ability for the heart to pump the blood. It can't be too fast, because if it's too fast, there's not enough time for the heart to fill back up fully. It can't be too slow, because there wouldn't be enough blood to meet the body's needs. So it has to be occurring at the proper rate and rhythm, okay? Now that being said, that brings us into the 3 main types of heart disease that we see in dogs. The first one is called myxomatous mitral valve disease. It's a big long name, so we abbreviate it MVD. Basically, in this disease, the valves of the heart are what's abnormal. And the valves, especially the mitral valve, that's the one that's on the left side of the heart between the atria and the ventricles. The valve gets to be thickened and irregular and contracts down, so it leaks. So whenever the heart pumps the blood, it doesn't just all leave to the aorta to the rest of the body, it also backs up into the left atrium as well. Whenever you get that backing up of blood, now you have turbulent flow, and that's where we hear a murmur. Okay, so whenever we hear a leaky valve or a murmur, that's usually mean that one of the valves are leaky in the heart. Now, this type of heart disease is more common in small dogs. And this is actually by far one of the most common heart diseases that we're going to see. So I'm going to spend the lion's share of today's talk on MMVD. We're going to talk about a couple other forms as well, but they're going to be more cursory because there's a lot of overlap between them. And this is the major form of heart disease that we tend to see in small animals especially. Second type of heart disease is called dilated cardiomyopathy. This is where the heart muscle itself is abnormal. It gets weak, flabby, and kind of thin. And as a result, the heart does not have a very strong heartbeat. So it can't pump blood very efficiently, and it cannot empty the ventricles very well, okay? Now, this is more common in large breed dogs, Doberman Pinschers, Great Danes, things like that. So there is a difference in the types of heart disease we expect to see between small dogs and large dogs. And now the third type is called arrhythmogenic cardiomyopathy. This is a disease where the valves of the heart are normal, the muscle of the heart is normal, but the rhythm is irregular. And in this situation, the heart beats in a rhythm that is so irregular that it can't pump blood very efficiently, okay? Making sense so far on how we kind of go through these things, okay?
Just glad you don't get tests.
Maybe someday. Alrighty, now just to kind of understand the MMVD, what happens is a schema of the heart. We're going to focus on the left side of the heart, but remember, the heart is actually two pumps in one. So in the mitral valvular disease, the mitral valve, this is right here, the leaflets get thick and irregular, and they don't meet and close whenever the heart ventricle contracts. So the blood not just goes into the aorta like it's supposed to, some of it backs up into the atrium. Now in the very early stages, that's all that happens, just backs up a little bit, you hear a murmur. But over time, heart builds up in the atrium, so then the atria starts to get dilated and expand, increases in its pressure, so the atria accommodates it by getting larger. Over time, then the pressure backs up into the pulmonary veins that come from the lungs, so then the pulmonary veins start to distend. And then if the pressure continues to build up, then it backs up into the lungs and fluid starts to leak into the lungs, okay? And this is when we start getting into congestive heart failure, when there's fluid leaking in places that it shouldn't leak because there's so much back pressure coming from the heart. Now remember that these are two valves, and the tricuspid valve, which is the one on the right side of the heart, can also be abnormal. So if the right side of the heart becomes abnormal and backs up, then we see body fluid building up in body cavities, the abdomen, in the chest around the lungs, not within the lungs, and in a space called the pericardial space, which is the space around the heart in a special sac that holds the heart contained. Usually it builds up in the abdomen, it can happen in the other places. And again, if the left side of the heart is the one in failure, the fluid backs up into the lungs and the lung parenchyma itself, okay? Now, going through that progression of how heart disease occurs has led to us categorizing or staging heart disease based on its severity, A, B, C, and D. Stage A is a dog that has no heart disease present right now. So the valves are normal, the heart muscle is normal, the rhythm is normal, but they're a breed that is at risk for it. Cavalier King Charles Spaniels are the hallmark breed for that. Miniature poodles are very common to have something like that. So this is stage A. The heart's normal, but they're a breed that is at risk for heart disease. Stage B means that there's starting to be structural changes to the heart. For MMVD, that means the heart starts to get leaky and you hear a murmur, okay? Stage C is whenever now the leaking valve is so bad that there's fluid accumulating, usually in the lungs, but also in the body cavities, depending if it's the left or right side of the heart, respectively, that is failing. And this is where you need to start having a lot of medicines to keep the congestive heart failure from getting out of hand and to control it and get it stable. Stage D is actually when you have congestive heart failure that doesn't completely respond to the traditional medicines. It's at the later or the end stages of the heart disease in stage D for us, okay? Now, in stage B, this is where you have the heart leaking a little bit, where you can hear a murmur, but they're not yet in congestive heart failure. We substage this into stage B1 and stage B2, okay? And the original picture I showed you actually exemplifies that. So in stage B1, you have a leaky mitral valve and there's some murmur and some turbulent flow, but the left atrium is still normal in size, okay? Stage B2 is when you got the leaky mitral valve and there's back pressure, but now the left atrium starts to enlarge, okay? Now, at this stage, remember, the pressure has not yet backed up into the pulmonary veins or into the lungs, so they're not yet in congestive heart failure. So both of these stages, stage B1 and B2, are asymptomatic. The only way to tell the difference between these two is to image the heart in some way. Radiographs are okay. Echocardiogram, which is an ultrasound of the heart, is better, and ideally both imaging modalities should be used, both radiographs and echocardiogram, so we can most accurately and most early detect when the patient goes from stage B1 to stage B2. Now, the reason why we have categorized this way is because of a study that was conducted between 2013 and 2015, and the results were actually published in 2016. It's called the EPIC study. EPIC stands for Evaluation of Pimobendan in Dogs with Cardiomyopathy Due to MMVD. Now, pimobendan is a newer heart medication that is a really wonderful and innovative heart medicine. It's called an inodilator. Inotropy is the strength of the heartbeat. So it's a positive inotrope. It helps the heart beat with more strength. And it's also a dilator, which means it opens up or dilates the blood vessels around the heart to make it easier for the heart to pump in the correct direction, okay? So it's a dual mechanism of action that the pimobendan does. And in this study, they had half of the dogs that had MMVD that were in stage B, and they had some heart enlargement, so technically they were in stage B2 heart disease. Half of them got pimobendan, the other half got a placebo. And what they found is those dogs that had pimobendan had a delayed onset of congestive heart failure by up to 15 months. About 60% of them had a year and a quarter of asymptomatic heart disease. They also saw that those dogs with pimobendan lived up to 5 months longer. So this was the first proactive drug that we have available to be able to use in dogs to keep them from going into heart disease in the first place. But again, the only way to know is by imaging the heart in some way, okay?
How early? It has to be
in stage B2, I'm sorry. So that means that when we find that the heart starts to enlarge, we get the left atrial enlargement, that's when you start it, okay? Now, it's variable. This is a slowly progressive disease, so that can take months, even a couple of years for that stage to develop from stage B1 to stage B2. But the only way to know that is to periodically image the heart with ideally echocardiogram and x-rays, but if not echo, and if not that, then just the radiographs, okay? So that's when we start the pimobendan. Now, this result was so dramatic that they actually prematurely stopped the study. The reason why they did is not because it was a bad study, but the results were so dramatic that they wanted everybody to benefit from the medicine. They do this in human medicine too, when you got a very effective and safe treatment that has very dramatic results. They stop the study and say, let's get everybody on this medicine so everybody can benefit from this medicine. So for that reason, we now have the distinction between stage 1 and stage B2. So whenever you go to your veterinarian and they say, I hear a murmur, the dog is asymptomatic, let's take some x-rays or let's do an echocardiogram, and there's good rationale for that, because if we catch them in stage B2, start them on pimobendan and keep them disease-free, or asymptomatic, not disease-free, but asymptomatic for much longer than they would if they didn't get pimobendan in the first place, okay? All right, now I'm going to cover a concept now called resting respiratory rates. This is something that we're telling people to do more and more often. Cardiologists have been doing it for years, and general practitioners have also been doing it also for many years. And the reason why we measure this is because, remember, as the heart goes from stage B2 into stage C, which is then congestive heart failure, the lungs will start to fill up with fluid, so they can't aerate as well. So the first thing they're going to have happen is the body's going to want to increase the resting respiratory rates. So breathe faster so you can get more air into the lungs because they're not aerating as efficiently, okay? Now, when you measure the resting respiratory rate, you want to count how many times they breathe per minute, okay? And in dogs, in cats, and people, a breath is considered inspiration, expiration is one breath. So in, out, one, in, out, two. Now, a minute can be a long time. So you can do it for like 15 seconds and multiply by 4, or 30 seconds and multiply by 2, whichever is your way you like to do your math, okay? Now, this is actually one of the earliest signs of heart failure. Now, other things will cause an increased resting respiratory rate, not just heart disease, but if you've got a dog that has a murmur that's on pimobendan, and now resting respiratory rate starts to rise, that could be a clue. I want you to see the veterinarian rather than just waiting it out. And this happens before they become lethargic, before they experience shortness of breath, before they get exercise intolerant, and before they start coughing. So it's going to be a really early sign, if they were in tune to it, can really facilitate early and timely intervention. Now, the resting respiratory rates that we tolerate is up to 30 breaths per minute when they're resting, okay? Not when they're running around, or not when they're just barking at the TV or the squirrel that's outside us, when they're resting or sleeping, okay? That's going to be the important part. Remember, this varies a lot from minute to day to day, so you don't want to be overly sensitive to just one increased resting respiratory rate. If that's the case, wait an hour or two, measure it again, and see if it's persistent, okay? Now, if you, in stage B2 heart disease, you want to keep track of this 1 or 2 times a week, just to kind of keep a steady track of where things stand for the resting respiratory rate. And if it does increase, then you want to be mindful of it. A lot of dogs will have a resting respiratory rate in the high teens, 16, 17, 18. So I also let people know that if you see a consistent trend, like say Monday you measure it and it's 16, and then Friday you measure it and it's say 21, and then on Wednesday you measure it and it's at 28, and then the next day you measure it and it's 29. You're still not over 30, but you're trending pretty steadily that way. That's also a warning sign that the dog should be seen and evaluated to see what's going on with it, okay? Now, they actually have a lot of apps on your phone that you can use to help you out with it. One of the ones that cardiologists like is called My Pet's Heart to Heart, and it actually will help you learn how to do the resting respiratory rates, keep track of it, keep a log of it, so you can have a really nice way to measure. It's not just the old-fashioned paper and a piece of paper or a notebook like we used to do whenever I was in the day, okay? All right, now, once we enter from stage B2 to stage C, now we're in the congestive heart failure. That's whenever the lungs start to fill up with fluid, okay? And if it's the left side of the heart, it's going to be lungs filling up with fluid. If it's the right side of the heart, it's going to be body cavities that fill up with fluid, usually abdomen, sometimes around the lungs, things like that. Most of the time, it's left-sided heart failure, but we will see dogs, especially in the later stages, that both ventricles are failing, so we see both fluid in the lungs and building up in the body cavities, okay? Now, we diagnose stage C based on a combination of the symptoms that you guys notice at home, the physical exam findings, and usually radiographs of the chest, but we can usually make a presumptive diagnosis with a fair amount of accuracy just from the clinical signs of the physical exam, okay? Sometimes we'll need some additional types of imaging besides just radiographs. We have basically a focused ultrasound exam. We call it POCUS, point of care ultrasound is what that stands for, okay? And that's most useful whenever you have some pulmonary edema or fluid in the lungs that we're not sure about, or if we have fluid building up in the cavities subtly and you just can't feel it. So the ultrasound can be a very sensitive way to pick up on those things that we can't always tell just with radiographs or physical exam alone.
Can you do those ultrasounds here?
Mm-hmm.
Okay.
We'll do those here, yeah. Now, note that we don't need to do an echocardiogram, an ultrasound of the heart to diagnose congestive heart failure. In fact, an echocardiogram does not tell you if the patient is in congestive heart failure. The radiographs will do that because the echocardiogram looks at the heart. Congestive heart failure occurs whenever there's fluid build up in the lungs. We're not looking in the right place with an echocardiogram to see are they in congestive heart failure. Now we'll see changes that will suggest, yeah, these are all consistent with congestive heart failure, but we still need the radiographs to confirm that it is congestive heart failure indeed, okay? So what are you guys going to notice at home? We talked about the increased resting respiratory rate. As it progresses, the dogs will get more lethargic. They're not going to have as much energy. They're going to have a little bit of weakness. They can have shortness of breath. They have a tough time catching their breath, and they also can be what we call exercise intolerant. They don't need to exert themselves very much before they have to stop and catch their breath. They start coughing after a while, but we really don't know what causes the cough in heart disease, to be honest with you. It's not necessarily the fluid that's building up that causes the cough. We're not really sure the mechanism. It sometimes will happen with the fluid in the lungs, but remember, hearts also get big, and where the heart enlarges also puts pressure on the main airways in the lungs, so it tickles the airways, so that can also contribute to a cough. But we don't always say that because there's a cough, it's from fluid in the lungs. And similarly, you don't always have to have a cough for there to be fluid in the lungs. It's the increased resting respiratory rate is what we're going to get with that, okay? Now, if it is really bad, where they really can't catch their breath and they have fainting spells, what's called syncope, okay, so they collapse. Like I mentioned, if it's the right side of the heart that is failing, which is less common, then we also will get some fluid building up in the abdomen. You get a big pot belly look to them whenever it gets really sore. Okay? Now, when you see these signs, you bring them to me. The things I notice is, of course, the increased respiratory rate, but I also will notice that there's an increased effort to both, usually in inspiration and expiration, but most dramatically on expiration. The reason is, whenever there's fluid in the lungs, and then you exhale, there's increased pressure to squeeze those lungs. So you're squeezing down on already compromised airways, so they narrow even further, so there's a more effort to expel air from the lungs for these guys. They tend to have what's called cyanotic mucous membranes, so gray or blue color to their membranes. They're not nice and pink, okay? And they can also stand on the respiratory distress in what's called an orthoptic position. They stand with their head and neck extended out to maximize and straighten out their airway so they can get more air into the lungs that way, okay? Those things you can actually notice at home too, but I'm just a little bit more trained to pick up on these nuances than you guys are sometimes. And then when I'm doing my exam, I'll of course notice the murmur, there's an increased respiratory heart rate, there's what's called crackles in the lungs. That's the indication that there's fluid in there, usually. Other reasons for crackles too, but crackles usually indicate fluid in congestive heart failure. They don't have very strong pulses because the heart's really working hard to do what it needs to do. And if there's fluid in the belly, then I can usually pick up on some of that on the exam as well. Now from here, usually if the dog's in distress, then I go and take it into the treatment room, get them on oxygen, start them on treatment and things like that. I don't rush to x-ray, because whenever they're in respiratory distress and you go to position them on the x-ray thing, they can decompensate even further. So our first goal is to stabilize them, and then we reach for further diagnostic to confirm our suspicion. Now, I'm not going to go into the x-rays and the ultrasounds and things like that, because that's for me to know. You guys don't need to know that as general public. And so it's a little bit beyond the scope of this lecture, so it's going to be a lot of details that would only lengthen the lecture. It's already a big one to start with. So I'm not going to go into the other type of findings that we tend to see right away.
When they get that cough,
Yeah.
does it like turn into a gagging cough
Yeah. Mm-hmm.
and fluid comes out?
In the very extreme stages, fluid and foam can come out of the lungs and the heart, but most of the time it's a non-productive cough. The fluid has to be really filled with, the lungs have to be really filled with fluid for that to be so much that it's not overflowing into the upper airways.
So is it more prominent, like when they get a drink of water, and after they drink water, then they get that cough? It's like a gag, and it comes back
That is
out.
usually they just have a little bit of either they inhale some of the water, or their voice box or their larynx doesn't close the airway very well, so they inhale a little bit and then they have to clear their throat. That's more likely that, not heart disease. Remember, you're going to get an increased respiratory rate, you're going to get lethargy and weakness way before you get a cough and heart failure. So if that's the only sign, it's probably something else triggering that cough, okay? So that's usually what it is. But whenever I see a productive cough, it's usually not congestive heart failure unless they're in the very end stages, and those dogs are really put out, okay?
What does a dog cough sound like? Because you know, you have like what you're saying,
Right.
you have the reverse sneezing.
Right. Reverse sneezing is a little bit different. A cough in a dog is very similar to a cough in people. It does sound like what we're doing, so it's usually not very hard to mistake. Cats can be a little bit different, and whenever I do the heart lecture in 2 weeks, I'll probably show videos of difference between a cough and a vomit, because there's a lot of confusion between those
Oh, geez.
in cats. Right, believe it or not, it sounds like very different things, but cats are cats. They're a unique species. They're definitely not little dogs. They're definitely a species in and of themselves. So we'll go into that more, but a cough in a dog sounds just like a cough in a person for us. Now, in cardiac-induced coughs, many times it's nocturnal, which means that they're sleeping and they wake up coughing, okay? So it's usually a nighttime type of a cough, usually non-productive, and they usually have an increased respiratory rate and some effort associated with that as well. So if I hear a dog that's coughing at night mostly, my little warning bells goes off, looks like maybe it could be heart disease. Let's take a little extra attention to that heart on the exam today. But usually the cough after drinking is because they just inhale a little bit of the water and they have to clear their throat, so to speak. Okay? Is that making sense? Okay, great. All right, now, once we are in congestive heart failure, treatment is multimodal, which means you have to use multiple different medications with different mechanisms of actions to stabilize the heart disease itself. Okay? Now, we talked about pimobendan already as an inodilator. That's going to stay there. Sometimes we'll increase the dose a little bit. But then we also use furosemide, which also is called Lasix. This is a diuretic. We basically dehydrate the body so that the water gets drawn out of the lungs. Another one's called an ACE inhibitor. ACE stands for angiotensin converting enzyme, and these are inhibitors for that. Angiotensin, there's two forms of it. Angiotensin 1, which is the not very active one, and it gets converted into angiotensin 2. Angiotensin 2 is a very aggressive vasoconstrictor, so it constricts the heart vessels around the heart so that they have a harder time pumping blood into them. And it also acts on the kidneys by stimulating what's called aldosterone secretion. Aldosterone basically promotes sodium and water to be reabsorbed into the body, so it causes volume overload. Both of which in a normal dog with a normal heart that's bleeding out are good things, but for a dog that has a bad heart is counterproductive. So an ACE inhibitor can both be a way to open up the blood vessels around the heart and prevent volume overload or water retention. And another one called spironolactone. Spironolactone is technically a diuretic, but we're not using it for its diuretic purposes in heart disease. Spironolactone also inhibits aldosterone, so you don't have sodium and water being retained in the body. And it also has some antifibrotic effects. And the heart disease progresses, there's scar tissue that builds up in the heart muscle. So it helps to prevent some of that and keep the heart a little bit more functional for a little bit longer. So right away, we're starting with 3, if not 4 drugs. So don't be surprised if we diagnose your dog in stage C heart disease. When you go home, you're gonna be going home with multiple drugs every day, all the time, okay? And these are lifelong, okay? Now, yeah, vetmedin and pimabendin is the same thing. I'm going to turn the lights off because I'm going to show you a couple of radiographs. I told you I'm not going to go into a lot of details on how we diagnose, but I want to show you the before and after pictures whenever the dog's in congestive heart failure compared to after treatment. Now these changes are subtle, so I'm going to guide you to where we are. Now these are the same dog. This is before treatment. This is after treatment, okay? Now, just to orient you, this is the dog laying on his right side. The head's way over here off the view, okay? And then you can see the shoulder blade and some of the front leg here. There's the spine going down this way here. Here's the sternum or the chest bone. Now this line here is the diaphragm. So that means everything up here is in the chest and everything back here is in the abdomen. Now the first thing you see really big is right here is the heart, that big oval shape right here. If you look later closer, you can see there's an extension up here. That's the left atrium. Remember in heart disease in stage B2 and above, the left atrium gets bigger, and that's what this is here. This dark line here is the trachea, the airway. The reason why it's dark is because it's filled with air. Air is dark on radiographs, and then as you get more and more dense with the tissue, it gets gray, and then eventually white, like you're seeing here with the metal here. So, and when you look here in the lungs, you see that there's a lot of gray there, not dark. Same thing here, a lot of gray here, not very dark, okay? If you look really close, you can see that there's 2 vessels right here. One is called the pulmonary artery right here, and the other one is a pulmonary vein. And the veins are dilated compared to the arteries, okay? And that's, again, a feature of congestive heart failure. Now, this dog was put on oxygen, had a diuretic given to him, and also a vasodilator. And after a couple of hours, this is what it looked like. Now, notice the difference in the lung area. Look how much more clear this area of the lung is compared to here. Most notably, you can see the vena cava. This is the main vein that takes the blood from the body to the heart. Look how much more clearly you can see the outline of the vena cava. Also look down here. How much darker this lung field is here.
That was a couple of hours?
This is a couple of hours. Usually you can stabilize it within a couple of hours, right? And here's another case we just saw last week, actually, here. The same things. Big heart, trachea there, a lot of grayness in the lungs here and down here. And this was about 2 hours later. We repeated the x-rays, much clearer. You can see the caudal vena cava very clearly, and there's a lot of air in the lungs here. So
does it really reduce the size of the heart?
It can. Pimabendin can actually reduce the size of the heart, and that's a good thing.
That's amazing.
Yeah, it's really good because the bigger the heart, the further away those valve leaflets are, so they get leakier. So if we can shrink the size of the heart, we can actually have improved function of the valves and reverse some of the heart disease process. So pimabendin can actually decrease the size of the heart. Now we have to be a little bit careful because pimabendin doesn't do it that quickly. So it also is possible, this is, we caught the heart whenever it is in relaxation, and here was contracting. That can also change the size of the heart in a matter of a couple of hours. But in the long term, we can actually see slow, progressively decreases in size in the heart measurements because of the pimabendin, and that actually bodes well for stabilizing the heart and improving heart function. Okay, good. All right, now, in addition to building up with fluid in the lungs, there's other complications that you might need to, or you might encounter with congestive heart failure. One is called pulmonary hypertension. Now, we're talking about the pulmonary arteries, the arteries that go from the heart into the lungs, okay? Not the body veins and arteries.
Can we turn the light back on?
Oh, sorry, yes.
Yeah. It's easier to read the words. Thank you, Dr.
No
Mike.
problem, yeah, sorry about that.
I can't believe
All right,
it.
so in pulmonary arterial hypertension, it's a consequence that we still don't understand fully the pathophysiology of it, but if it is present, it can also lead to persistent cough, exercise intolerance, and also fainting, even if the heart is not in congestive heart failure at the time. The only way to diagnose this is with an echocardiogram, so we need some higher end imaging studies in order to prove if this is there or not. Now the treatment for it is sildenafil. Anybody know what sildenafil is for? Okay, yeah. So it is Viagra. And interestingly enough, sildenafil was originally
Right.
developed for treatment for pulmonary hypertension, but during the clinical trials they noticed an interesting side effect. So now they use it for the side effect, not what it was originally developed for. But we can still use it in dogs for what it was originally intended to, and that's the pulmonary hypertension, okay? Now, another consequence we see is arrhythmias, abnormal heart rhythms. Remember, the heart becomes more and more abnormal as the heart disease progresses and can start to develop abnormal heart rhythms. There's a dozen or two different types of abnormal rhythms can develop, and it needs an electrocardiogram or an ECG for us to be able to diagnose that. And the treatment depends on the type of arrhythmia and how severe it is. Not all arrhythmias do we need to treat, and different arrhythmias are treated with different medications for us, okay? All right, any questions so far? Yeah.
With the ECG and with the echo, do you have to somehow sedate the dog?
Sometimes with the echocardiogram, just a touch of sedation because they have to hold really still on their side
Right.
for a while while we do that, but just a touch. The ECG, it literally just takes a couple of minutes, and we just lay them on their side and give them thinking happy thoughts, and we hope that clips up to their legs, and then we run out the rhythm strip. It only takes a couple of minutes for us to do an ECG, so usually not sedation
Oh, okay.
necessarily for that. Now, one of the treatments for congestive heart failure is sedation because it's a very anxiety-filled state, and because of the anxiety, they actually have even more difficulty breathing, so we calm them down with some sedatives, and they actually breathe easier even before we clear the lungs of the fluid. So that is one of the treatments for the acute crisis,
Okay.
but for the diagnostics, we are usually very minimal, if any, type of sedation for these guys. Okay? Alrighty, good. Now for long term, what we expect with MMVD is a slowly progressive disease, okay? So it's not something that changes usually from stage B2 to end stage D very rapidly, okay? But periodic monitoring is going to be essential for us to make sure that we keep up with the changes, we adjust the medications, identify any complications like the pulmonary hypertension or other things going on for it. So we do want to periodically monitor them. The frequency of the monitoring depends on the stage of heart disease. The more advanced, the more frequent we get. So initially it might be every 4 to 6 months, but as it gets more progressive, it might be every few weeks to every couple months, depending on where we are with it, okay? Now when we're to start stage C, once we're in congestive heart failure, you want to start measuring the resting respiratory rates every day because they're in a more unstable or more advanced state of the heart disease. So the more frequently you monitor them at home, the earlier we're going to pick up on when things are starting to go south, and we can have a more timely intervention and stabilize them more easily for us, okay? Now over time, with all the different medicines, between the diuretics and also the ACE inhibitors and the spironolactone, we chronically dehydrate the body on purpose. We don't want a lot of fluid for the heart to have to pump against. But that can be hard on kidneys. Kidneys like lots of fluids, okay? So when we reevaluate them, we don't just reevaluate heart function, we're also evaluating kidney function as well. So don't be surprised if we tell you x-rays and blood work, maybe an ECG, maybe it's time for another echocardiogram, depending on what's going on and what we suspect might be present at that time for you guys, okay? And once they start into stage C, by the time they progress to the end stage D, where we can't do much about it, it's about usually a year to a year and a half. So it's not a long time, but it's not just in a short crisis you're going to be in the dire straits, okay? Alrighty. All right. Now stage D mitral valve disease, whenever they're still in heart failure despite all the medications. So there's still some pulmonary edema, there's refractory pulmonary hypertension, there's still an arrhythmia that we can't completely normalize, or they keep building up with fluid in the body cavities despite all the medications. So here's what we need to do. Increase doses of the traditional medicines, add other medicines on top of it. Many times the benefit of a cardiologist can be really helpful for these guys. But remember, we're now in the final stages of heart disease. And short of a heart transplant, which we're not yet doing, or valve replacement therapy, which we do in dogs, we can't reverse heart disease. So this is the time we really have to start having a good heart-to-heart with yourself and your dog to see what is their quality of life and how much further do we really want to go. Okay. All right. Next type of heart disease is called dilated cardiomyopathy. Now in this disease, initially, the heart valves are very normal. okay? But it's the heart muscle that is weakened, okay? And because it is weakened, it gets thin and flabby and it can't pump blood very efficiently. So as opposed to MMVD, which is a backward failure of the heart, this is a forward failure of the heart. It's not pumping blood into the blood vessels the way that it should or very efficiently, okay? Now, unfortunately, because the heart muscle is weak, it also starts to dilate and start causing heart enlargement. And with the heart enlargement, then you're going to start getting separation of the valves of the heart. So then you start getting leaky valves. So as it progresses, you get also backward failure, not just forward failure with it. And because the heart muscle is abnormal, arrhythmias are much more common for dilated cardiomyopathy in the earlier stages compared to the MMVD patients that we see. Now, like I talked with MMVD, that's usually a small dog disease. Dilated cardiomyopathy, or DCM, is a large breed dog disease. So Doberman, Pinschers, Great Danes, Newfoundlands, Wolfhounds, and other breeds can be predisposed to dilated cardiomyopathy. Okay? Now, when we're talking about dilated cardiomyopathy, there's two main categories of causes. The first is called primary DCM, and this means it's genetically based. It's inherited. It has got family members that all have the same disease, and this is where they're genetically prone to that disease for these guys. Secondary DCM occurs because of something else is insulting the heart, toxins, and one of the chemotherapy drugs we many times will use is called doxorubicin. Doxorubicin is cardiotoxic, you can only give so much before it causes DCM, and so that's kind of a trade-off with that drug. Infectious disease is a rare disease called Chagas disease, which is a protozoal infection of the heart that can cause dilated cardiomyopathy. See it more in the south, don't see it up here, so I don't have to worry about it up here. And then you have nutritional DCM. Taurine deficiency is something that we will see from time to time. Most common in cats. Years ago, back to before 1992, we used to see DCM in cats all the time, and we found out it's because they cannot make taurine on their own. So they need to supplement it into the cat foods. And as soon as the cat food companies all realize that, every cat food has taurine in it with it, so now we hardly ever see DCM in cats, okay? But we also see taurine deficient DCM in dogs. We can have heavy metal toxicities. And more recently, since about 2018, we're finding that there's certain diets that can trigger DCM called the BEG diets. Boutique diets, these are the small companies that come up that don't really have a lot of research and development behind them. Those diets with a lot of exotic ingredients in them, and also those that are grain-free, okay? So those are called the BEG diets that we see can be a nutritional cause for dilated cardiomyopathy. Now, just to give you an idea how dilated cardiomyopathy is, over here on the left is a normal heart, where you can see normal thickness to the heart muscle of the ventricles. Where over here in dilated cardiomyopathy, you can see that the heart muscle is thin and flabby. And it happens in the right ventricle as well, but the changes are more dramatic in the left ventricle. And then the heart starts to dilate and get to be really, really big. Now, as it dilates and gets really big, you see that the leaflets of the mitral valve start to separate, so you also get leaky valves after you get a little bit more heart enlargement with these guys, okay? Now, like with the MMVD, you have 4 stages of the DCM, stage A, B, C, and D with the same definitions. The only difference here is stage B1 and B2 is not as clearly defined, okay? So you can have asymptomatic heart disease in these guys, and cardiologists will have sometimes a good heart-to-heart with themselves. Is this stage B1 and we don't need medicines? Or is this maybe stage B2, we might need to start them on some medicines, and if so, what medicines are they? So do we need to get on things that will increase the strength of the heartbeat? Do we have to get them on things that will prevent clots? Do we have to get them on antiarrhythmics? Things like that. And the reason why it's important is because even in stage B2, like I said, arrhythmias are more common in this stage than in the MMVD. And one of the first signs in some dogs is just they collapse and die. That's it. There's no signs that tell you it's coming. So that's why if we start saying, okay, there's a little bit less contractility, there's a little bit less flow, looks like congestive heart failure might be coming because the left atrium is starting to fill up a little bit, or the arrhythmia is a little bit more malignant in its appearance, we might start them in stage B2 even before they go into congestive heart failure, okay? So this stage takes a little bit more of a medical judgment to distinguish between stage B1 and stage B2, and this is where the expertise of the cardiologist many times can be of large benefit, because they deal with this every day. That's their bread and butter, okay? All right, so what are you going to see with the clinical signs of DCM? Similar to mitral valvular disease, with the exception that you don't get congestive heart failure initially, okay? So increased resting respiratory rate, lethargy, weakness, shortness of breath, exercise intolerance. They can do some coughing with it as well, and it can have abdominal distension, because now this disease, both the right and left side of the ventricles are affected, so you can build up with body fluid even before they fill up their lungs with fluid. You can get collapse. Now the collapsing is a little concerning with DCM and also the next type of heart disease, arrhythmogenic heart disease, because whenever they're fainting in this disease, it's because the heart is weakening so inefficient, or so pumping so inefficiently because it's so weak, or the rhythm is so irregular that it's not pumping blood around, they're this close to dying.
Yeah.
So cardiologists sometimes facetiously call, in this type of heart disease, fainting spells or syncope as aborted sudden death. So kind of gives you the importance that if your dog's fainting, and it's a large breech dog, that's a bad sign. Okay. And then we talked about sudden death being something you don't have any warning. I just plump over and they're gone. Okay. Now, stages C and D in DCM are initially treated very similar to MMVD, imobendan, diuretics, ACE inhibitors, spironolactone. But there's a few nuances in DCM that we also would also have to deal with. Like I talked about, arrhythmias are pretty common, so we need to get them on arrhythmogenic or anti-arrhythmogenic type of medications. And so that's something we might need to deal with, and depends on the type and severity of the arrhythmia that we use to treat. Nutritional support, like I said, some of these can be taurine deficient. We get them on taurine, and we can go ahead and get them supported and help them with that. Sodium restriction, because sodium gets resorbed into the body, that causes fluid and water buildup in the body, and that can be hard on an already weakened heart. And then if they are on a BEG diet, we try to say, let's go to a more traditional diet than one of the BEG diets, okay? Now, if there's fluid building up in these guys, because right ventricular failure is fairly common, we might have to drain the fluid to get them to be more comfortable. But we have to be careful, because we're also draining proteins and also body essential nutrients with that, so we have to be balanced between what's going to be beneficial for the patient versus detrimental, okay? Now, I do want to talk a little bit about this diet-associated DCM. In 2018, like I said, we first discovered it, and it was actually through a group of very astute cardiologists. They're a small group of specialists, and they keep in close contact with each other, even though they're spread out all through the country. And they started noticing DCM in dogs that didn't traditionally expect it in. So it wasn't just your Dobermans and your Great Danes. Now we're seeing in Golden Retrievers and little dogs, things like that. Like, why are we getting DCM in these dogs? So they started looking into it, and they joined up with the FDA, and they found out that there was a link with these BEG diets. Again, boutique companies, exotic ingredient diets, and grain-free diets. And what they further found out that is the common thing between all these diets are they're high what's called pulses or legumes. They're the things like lentils, peas, pea flour, chickpeas, garbanzos, sweet potatoes, and things like that. If you see these products in the first 10 ingredients of your bag food, that's a BEG diet. And it may not be the most healthy diet for us to be feeding our dogs, okay? Now, watch on the labels. Companies can be very tricky. And what they'll do is they'll split peas and pea flour and chickpeas all separately, so they are lesser in proportion, so they'll be further down on the list. So if you see a lot of these pulses ingredients further down the list, when you clump them all together, they're actually one of the major ingredients. So be careful of the labels. They can be tricky. You can't have an easy time looking at the ingredient list to know you've got a good quality diet. So be mindful of those things for us. Now, there's still a lot not known about these diet-induced cardiomyopathies in these guys. Some dogs are taurine deficient and do respond to taurine supplementation and improve with it. Others aren't, okay? It's not just a taurine deficiency, even though some dogs are taurine deficient. So cardiologists are still going to measure taurine levels just to be sure, but some do need it, some don't. It's not always just taurine associated, or the precursors to taurine, which is called cysteine and methionine, that the dog uses to make taurine. So it's not always that ingredient itself. And we're really not sure what the interactions are between that and metabolism of taurine or other things associated with the heart that causes these guys. But they've shown that if you've got a household that has multiple dogs and they're all fed these BEG diets, those that are symptomatic and they're diagnosed with cardiomyopathy, cardiologists say, let me see your other dogs. And a lot of times I will find asymptomatic DCM in them as well. They're just not showing signs. So unless they did a proactive echocardiogram, they're not going to know if that was present or not until it's later on and almost too late sometimes for these guys. Now, these dogs need to eat these diets for a long time. It's not just a meal or two that you're going to do harm. This has to be given to them for months or even years. One study showed there was an average of 4 years these dogs were fed these diets before they developed the DCM. So it's not just a short-term thing, it's a long-term thing. But they weren't fed anything else, it was just these diets alone, and so it was a pretty strong thing. And the interesting thing about it, whenever the cardiologist started saying, let's get them off these diets and something more traditional, the heart disease went away. So their hearts can normalize with traditional diets if they're not fed high pulse ingredient diets. Yes.
We have a question.
Okay, great.
And the question is, what diet is recommended for a dog with stage B preclinical CHF?
Good question. I'm going to answer that next. You're anticipating very, very well. And like I said, not a lot is known about this type of heart disease. And so the recommendation is if you've got a dog that has DCM and they're on a BEG diet, it would be ideal to get them off the BEG diet and you do something traditional. But it is only a very small percentage of dogs. When they initially did the studies, by 2019, a year into this investigation, despite millions of dogs being fed BEG diets, they only had 325 cases. Very small percentage. So we can't just say justify, get all dogs off of grain-free, get all dogs off of these BEG diets because it's horrible, horrible, horrible. So there's less certainty to know what to do if they're asymptomatic and they don't have heart disease. Now, if they do have stage B heart disease and you know it's there and they're on a BEG diet, it is recommended to get on a more traditional diet. There's a lot of good traditional diets out there. I'm a little bit biased because I stick with what's called the big four. Purina, IMG Canuba, Royal Canin, and Holstein's diets. None of their lines have ever been included in those that are associated with these or have heart disease developed. But there's a lot of other good companies out there. I'm not saying that they're the only ones to choose from, but those are the ones that we have as our go-to recommendations for you guys. Okay? All right, any questions about that so far? Okay. Now, like I said, hearts can return to normal when they're gone from the BEG diets to something more traditional if they have this diet-induced DCM. But it takes a while, on average between 9 and 15 months. So you still need to treat them for their DCM. And in some cases, even if they're in the more advanced stages, cardiologists treat these guys more aggressively in the hopes that they're going to keep the heart stable long enough so that the diet change can start to have reversible changes with the heart muscle itself and get them to improve. So this is something that can be reversible. Now, not all dogs reverse completely. Some still have the need for some heart medications, but they usually can be weaned back off of it, and their long-term prognosis is much better than those dogs that have the more primary or genetic-induced DCM. Okay? All right, any questions about the diet-associated DCM so far? Okay, nothing online yet?
Nope.
Okay.
Just how amazing you are and knowledgeable.
Alrighty, good.
It is interesting that there was a time you were being told to go to grain-free because
Honestly,
you'd be
that's
less alert, allergies, etc., and so forth. So here you are doing the right thing for your dog, and then you find out, oh, maybe not so right.
Exactly, and actually all that was marketing. In dogs, they don't have the grain-induced inflammatory syndromes that we see people have, and so there's no benefit to grain-free diets at all. Grain allergies are extraordinarily rare. Food allergies in general are pretty rare. For those dogs with allergy, only about 15% of them have a food component. And although those beef and chicken and wheat are the most likely, grains are somewhere around 9 or 10 likelihood. So for the fraction of percentage of dogs that have a grain allergy, but them all on a grain-free diet is not a benefit. And now we know that there might be some harm with it too. So grain-free, to me, is just a marketing scheme. There's no health benefits. And there may be, in some dogs, a small percentage of them, a health risk with the grain-free formulations.
That was definitely an interesting factor in
Yeah.
your last presentation. Like, oh,
Yeah.
maybe grain-free was not the answer.
Exactly,
Yeah.
right, yes.
How about like a grain-free treat? Is that okay? Or because there's a lot of them that are
Grain-free treats I'm not too worried about as long as the main diet is the traditional diet. Because remember, these dogs that get this DCM were fed only this diet pretty solely without not a lot of other treats for years, months or years. So you're just adding a grain-free treat to an already traditional diet. You're not going to have so many legumes in that diet that you're going to have the risk of DCM. So I wouldn't have a problem with something like a treat. Okay? All right, now follow-up for DCM is a bit more concerning. It is a more rapidly progressive disease. Now the genetic version of it, usually within 3 to maybe 12 months if we're lucky, the dogs have already succumbed to the disease. So only a few months of life expectancy. And as a result, we do a lot of frequent recheck with these guys and a lot of really serious heart-to-hearts with the owners about how well we're doing and things like that for us. And unfortunately, remember that at any stage, from stage B2 all the way to stage D, these dogs are at risk for sudden death at any time. We can't prevent or predict if and when that might happen. And we don't even know, even with treatment, do we decrease that risk at all? We don't even know that answer at all for these guys. Now the exception, of course, is the diet-induced DCM. That one has a better prognosis, and we can actually do something that can reverse the heart disease itself, okay? Any questions about DCM aspects so far? All right, getting close to the final stages here, guys. We're running pretty good. The last type of disease called arrhythmogenic cardiomyopathy. This is a really long word that basically means that the heart rhythm is abnormal in the heart disease. Not that we call it a cardiomyopathy, which means that the heart muscle is abnormal. The heart function is fine, but somewhere in the heart muscle is the trigger for this arrhythmia. And I'll explain that in just a minute, okay? So the heart valves are normal, the heart muscle functions normally, but somewhere other than where it should be, an abnormal heartbeat occurs, and as a result, they get an abnormal heart rhythm. Now, this is very common in boxers, so much so that we actually call this boxer cardiomyopathy. And in boxers, in that traditional form, it's usually the right ventricle that is the source of this abnormal beat. So we call it arrhythmogenic right ventricular cardiomyopathy. Really long name, okay? It seems like the less we know about something, the bigger the names become, you know? And it's right in my alley because my last name's Stadler, so I'm used to long names. It kind of fits right in because it rolls off the tongue. Alrighty, guys. Now, to understand how this disease works, I'm going to have to go a little bit nerdy again. So ready to get your nerd hats on, and we'll go and delve into nerdiness for a little bit. Now, in a normal heart, this is another schema of the heart. Again, the right atrium, right ventricle, left ventricle. The heart actually has special cells that conduct electrical impulses, both generate and conduct electrical impulses in a very specific way. And it starts right up here in the right atrium with what's called the sinoatrial node that triggers an electrical impulse that travels to both atria pretty quickly, so the atria then will contract. The electrical impulse hits right here, right between the atria and the ventricles at a place called the atrioventricular node that then conducts the electrical impulse very rapidly without triggering the heart to contract very well until it gets down here at the base of the heart. Then the ventricles contract, starting at the base here, going up to, the apex here at the bottom of the heart, and contracting upwards towards the base of the heart so that the blood squeezes out of the ventricles in a very specific way. So whenever the electrical system is occurring normally, the atria contract to fill the ventricles, and the ventricles contract in a way from the apex up to the base of the heart so that the ventricles are emptied of their blood in a very efficient way, okay? Making sense so far, okay? Now, in arrhythmogenic cardiomyopathy, somewhere here in the right ventricle is the trigger or the impulse for the electrical impulse. So now the electrical impulse starts from here and goes across the rest of the heart. The electrical conduction system is normally used as a very rapid conduction of the electrical impulse. This is much slower. So the heart takes much slower to beat. It's not beating very efficiently because it's somewhere up here near the base of the ventricles, not down by the apex. So you don't get an efficient contraction of the heartbeats. And a lot of times this happens before the normal heartbeat would occur. So it's happening prematurely so that the heart does not fill up with enough blood. So usually for these beats, they're occurring early and they have decreased pulse quality or no pulses at all. So they don't pump blood very well. Now, if it's occurring just here and there, then there's the majority of the heartbeats are normal, you're gonna be okay. But if it happens really, really frequently, then there could be enough abnormal beats that then now the heart's no longer pumping blood efficiently, and then you get the symptoms of the heart disease. Now, just to show you how that works, I'm going to show you a few ECGs. Okay, now this is normal, so always start with normal. Okay, I'm going to just really brief. It's not going to be the real big details, just the big nuts and bolts for it. Now, in a normal ECG, each heartbeat has several waves to it. You got the P wave here, which is where the atria contract. Then you have what's called the QR complex, this big tall peak, which is the QRS complex, and the ventricles beat. And then here's a T wave where the ventricles basically reset to be able to handle another heartbeat. So you can see this rhythm is a little bit irregular, but that's normal for a dog to be slightly irregular as it changes with respiration. And every beat has a P, QRST, P, QRST, P, QRST. Now this next dog was actually a dog came to me because I had itchy skin, didn't even have any symptoms, okay? But because I do a thorough exam all the time, I listened to the heart and I felt that the heart rhythm was irregular. So I talked to the owner and doing an ECG. And this is what we found. Now, if you guys can see a little bit easier, you can see some normal beats with the P, QRS complex and the T wave here. So you got a lot of these here, normal beats. But look, you got also interspersed with those, these really big, wide, bizarre beats. Remember, in the long axis, this is times, and whenever you have a beat occurring in the heart muscle, it's a slower conduction through the heart. So you get a wide and a very bizarre look because it's having to travel on a different pathway through the heart. So you get a wide and bizarre complex. Okay, and if you look closely, look at the space between each beats here compared to the space between here and here. These are premature. Okay, so these are called premature ventricular contractions. Not very original, but that's what they're called. And each time we got these, I was feeling no or little pulses, but I could still hear some heart sounds. Okay, so it was kind of an unusual rhythm. Now, even though this dog was asymptomatic, there was enough heartbeats here. There's about 32 per minute, which is enough to start to compromise the ability to pump blood. So we got this dog on some antiarrhythmic medication. The dog did well for many years without treatment. Okay. Now, this is a mild case of it. Some dogs have this kind of disease, okay? So you can see normal beats, normal beats, normal beats, and then you got this big run of abnormal beats. Then it goes back to normal, big run of abnormal beats. Now this is only about a second and a half. If this goes on for 6 or 7 seconds, that's whenever the blood doesn't get to the brain and they faint or pass away. This is called paroxysmal ventricular tachycardia. A very inefficient way for the heart to pump blood. And so sometimes these guys just will be looking at you if this is only lasts for 1-2 seconds, but they still have a lot of that time where the heart's not pumping blood very well. Now the other concerning thing about this is that whenever you got the ventricular tachycardia, this is one severity of arrhythmia away from what's called ventricular fibrillation, which is cardiac arrest. So these guys, like I said, die suddenly because of these abnormal rhythms. And unless they're having these prolonged areas where they're fainting or they have exercise intolerance, they're asymptomatic. So like the DCM, sometimes the only sign we know that this disease is present is because they just fall over and pass away on us. Okay. Now, the clinical signs you see many times, like I talked, none. Sometimes you don't see any signs until I pick it up on the exam incidentally, or they start to have other symptoms like fainting and things like that, and we pick it up, or sudden death sometimes. They, of course, if the heart's not pumping very well, they get lethargic, they get a little bit weak. They have a lot of exercise intolerance, so they don't have the ability to exert very long before they have to stop and catch their breath. Syncope, which is again aborted sudden death in this situation, okay, because the heart stopped for a little while and then it started up again, thank goodness. And then even sudden death, like we talked about with the DCM for these guys, okay.
Panting is not part of that.
Usually not, unless they start with exercise intolerance, they'll start to pass. So, you know, they go up a set of stairs and they sit there, I really have to catch my breath now, kind of a thing, okay? Now, when we get this arrhythmogenic cardiomyopathy, we treat them with antiarrhythmic medications. That's the only really treatment for, because again, the valves are okay, the heart muscle's okay, but now we have to treat with antiarrhythmics. There's only a couple that we can choose from that we use for long-term maintenance. There's other ones that the cardiologists reach for because they have the expertise to use the more unusual and the kind of more esoteric type of drugs. And usually those are more in emergency settings, not just for routine long-term maintenance for these guys. Prognosis is fair, and it depends on how severe the cardiomyopathy is. Sometimes if it is mild, like I said, the one dog that I had lived for years with it and never had any disease associated with it, it ends up succumbing to something else. But if it's more severe, then you can have a much worse prognosis. Also, if the arrhythmia is severe, even if it is symptomatic, it over time will cause damage to the heart muscle. Then you do get DCM and on top of the arrhythmogenic cardiomyopathy, then you can get congestive heart failure signs with and things like that. So you can get a variety of different signs with it. So this long-term prognosis is very dependent upon how severe the arrhythmia is and how well we can correct it, and if there's any concurrent muscle disease going on with the heart as well. Okay? Any questions about arrhythmogenic cardiomyopathy? Wonderful. Now I put this picture up here because we talk about it amongst ourselves in the back every once in a while. Remember, big hearts are bad, right?
Yeah.
In cardiology, right? So every time I see the Grinch movie every Christmas, I'm sure when we get to that scene where his heart grows 3 times its size, every cardiologist in the country is going, I don't think so. That's a bad thing. So I just had to put that up there. All right, any questions about anything for us?
Yeah, how do you kind of tell the difference between heart issues and just simply growing old?
Well, the first thing I say with that is, and this has dropped into me whenever I was in vet school, is old age is not a disease.
I knew you were going to say that.
Yes.
I feel like it is.
Now, things happen and dogs do deteriorate and degenerate as they get older, but it's not just simply old age. they're getting arthritis and now they're painful, or their kidneys are starting to deteriorate and they've gotten kidney dysfunction, or they have a big liver, or they develop a tumor or cancer. These are more common in the more geriatric patients. But it's not just because they're old that they're sickly. There's something going on as they get older. So if you see them slowing down and they're not just their old young selves, well, it's best for us to evaluate them, because it's not just because they're old, there's something going on, and if it is subtle, some of these can be very subtle, even with heart disease or arthritis, like we did on our pain management talk and things like that. These things are best for us to evaluate. But the first thing I drum into people, don't blame it on old age, because what you tend to do is blame it on old age, then you overlook something that maybe you do something about. Okay, yes.
We have 2 questions.
Awesome, okay.
First one is, besides genetics, is there anything else that could predispose dogs to heart disease?
Well, just the secondary causes that we talked about, toxins of the heart, infectious diseases, which are pretty rare, or the bag diets, okay? So those are the ones that we can say these are predisposing to the heart disease, but those are the only 2 main causes, genetics or the secondary diseases of toxicities and or heavy metal or the bag diets kind of a thing, okay?
And our second one, are there any labs or markers we need to follow to be proactive and prevent CHF symptoms or complications?
Good question, and I left that subject out on purpose because that can add another 15 minutes to the talk. There are blood markers for heart disease, okay? One is called NT-proBNP, N-terminal pro-B type natriuretic peptide is a big long name for it. Another one is troponin that we can measure. Some will be measuring taurine levels and things like that. But these are just indicators of heart disease, and it depends on where the cutoff is placed on whether it's a good predictor or a bad predictor of heart disease. So the lower the value, the less sensitive it is, okay? But the more specific it is, the higher the thing, the more sensitive it is, but it's less specific, so you get a lot of false positives. So you can, most of the time when we're using those time of tests, if they're abnormal, we say we really should take a close look at the heart, cannot diagnose heart disease. The problem with them is a lot of these measurements, whether the NT-proBNP or the troponin C and things like that, if they're normal, it doesn't rule out heart disease. And to me, that's not a very good screening test. You want to catch it early. So I'd rather the test be a false positive and I pursue testing inappropriately rather than miss heart disease. So since they're not always very sensitive, we don't always use these tests. The cardiologists went together and they put together a website that has a lot of education for it. It's called the Cardiology Education Group, or CEG, or CEG. And whenever they go through their outlines of what's absolutely necessary, always when they looked at these monitoring tests, of the troponin C or troponin I or the NT-proBNP, they put those as lower priority. And cardiologists hardly ever use them because they've got echocardiograms and ECGs and tests that are much more sensitive and specific about diagnosing the heart disease.
So this is my own personal question.
Okay,
right?
good.
So we do send out pro-BNPs here. So my question is, like, what triggers you where you're like, okay, I definitely want to do this?
Okay. If I have, these are good tests to reach for if we can't reach for the ideal tests. So if we've got to say a dog that has a is a breed that's prone to cardiomyopathy but is asymptomatic, and we hear maybe a little bit murmur, do we have the ability to do an echocardiogram? No. Well, let's do an NT-proBNP or a troponin level and see, is there an indication that we really should push a little bit stronger for that? So we may run a test in that situation. It's a little bit more sensitive in cats, so it's a little bit more of a useful test in cats. So a lot of times if you got a cat with a heart murmur, we'll talk about this next week, only 50% of cats with heart murmurs have heart disease, and unfortunately the opposite is true too. Only 50% of cats with heart disease have a murmur, so you can't rely on the presence or absence of a murmur to detect heart disease in cats. Again, they're their own thing. So if you've got a loud heart murmur in a cat, and you got the cat not breathing very well, and you're not sure, is this from respiratory disease like asthma, and it just happened to have a murmur, or am I going into congestive heart failure? You can use an NT-proBNP to kind of help distinguish between the two. Sometimes if you're not sure and owners don't want to do an echocardiogram, you're pretty concerned about the heart disease, you could run an NT-proBNP to give you more evidence to push for the echocardiogram. But these blood markers, they're indicators, they're supportive tests that we can use for these guys, but they don't rule in or rule out heart disease. You still need the other tests to do that.
Is it, because I don't remember any of the, I don't memorize the prices because they're all, you know. Does that mean like the ProBNP is probably a little bit more cost effective than just to jump straight to an echo if
Right.
the owner's like
Yeah,
on the edge about
NT-proB is going to be
cost?
cheaper than echocardiogram, but the echocardiogram is going to be much more definitive about what's going on with the heart. So there's a trade-off. Okay.
Would you
Yes.
recommend, let's say, at age 10, doing a baseline set of testing, so sometime down the road, okay, we want to do some tests, let's compare it to the baseline when they're age 10?
That's actually good. Sometimes we'll do it even earlier. It's not wrong to do that even when they're younger, because when they're younger, that's unlikely for anything abnormal, so we get a baseline then. And then usually when they're in their middle years, 6, 7, 8 years old, it's not wrong to do baseline blood work on them or other testing. As time goes on, we're getting more and more proactive about trying to detect disease early in the asymptomatic dog. And it's just in my career, it was resulted in much longer lifespans than we used to have. When I was first graduated, we'd see dogs 10, 11, 12 years old, and those were ancient. Now we're getting them to be 16, 17, 18 years fairly commonly.
Yeah.
So we're getting much better at doing that. So yes, it is very beneficial to be proactive and get additional information about their health than just the physical exam alone, so we can detect things early and know what baselines are before they're even symptomatic. That's a very good way.
Would you think their normal visits here, you'd have enough of a baseline, or should we ask for some additional testing?
Just in this last year, our practice has gotten to be proactive in asking everybody for even wellness exam. Do you want to do some wellness blood work? So
Okay.
it is something we're proactively
Okay,
doing and
all
doing
right.
now. And a lot of practice has been doing it for many years, so it's never wrong. I do it whenever I see the dogs are a little bit off, or just as a proactive kind of a thing, that I think, okay, things are changing, they're a little bit subtle, acting older. So I said, let's do some blood work to see if there's something that is making them act older that we might be able to identify and do something about.
Okay, thank you.
Okay, sure. Yes.
Once they've been diagnosed with CHF
Mhm.
and they've been on the medication,
Yes.
and then that medication isn't doing everything, so
Right.
it's increased.
Yes.
Is there a timeline?
It's hard to predict because there's a lot of dogs that are different. Some dogs, they go into stage B1 and they never progress to stage B2, okay? But whenever you're in the more advanced stages in stage C, I've seen dogs rapidly decline in a matter of a few weeks. I've seen them last a few months. But remember, once they're in stage C, usually it's about a year to year and a half tops that we expect them to be. It's actually interesting that prognosis for cardiologists for their cases is actually worse than oncologists, cancer doctors. Yeah. Because the heart disease is so severe, and we can't reverse heart disease in most situations. Although they have an innovative technique they've done a couple of times at the University of Colorado with actually Tokyo veterinarians that actually replace and bring the heart valves back together, shrink the size of the heart, and they can reverse the heart disease. Really expensive, takes a lot of expertise, but we now can do valve replacement therapy in our canine patients.
So the best thing is they just get on the medication and
And
ride out the medication and
yeah, keep on the medicine, but also frequent visits. So even when they're acting normal, be proactive about monitoring them, because if we can detect the changes early, we can tweak the medications rather than wait until they're in crisis and have to try to drag them out of the crisis. So frequent rechecks is going to be critical. And I leave that, and there's not a set criteria to say, okay, after this stage, start seeing so many months. It's up to the veterinarian's discretion based on the severity of the disease when they feel the next most meaningful recheck would be for them. Okay? Yeah. But usually there's not a set time frame. Like once you enter stage D, you got so many weeks or months left, because there is a lot of variability, but it's usually not very long, unfortunately. Okay.
At what stage do you recommend the blood work?
Well, just wellness blood work, you usually start doing it not in due to the heart disease, but if we're going to be doing
Like a senior wellness?
a senior wellness, I just do that because they're older, not even if
Yeah,
there's
but
no heart
at what
disease
age
present.
would you?
I usually say about between 5 and 7 is when we want to do it yearly, but it's not wrong to do it even when they're 2 or 3 to get a baseline. So
What
it's not-
about an X-ray along with that? Just to see where their baseline is.
since cardiac or respiratory diseases that are asymptomatic are very unlikely, the only value really to radiograph is to see if there's cancer there, so that's not as good of a wellness screening test as the blood work is, because metabolic derangements are much more common and they can be more subtle in their early stages. Same thing with ultrasounds. Those are something that we can do, but to do it proactively, just to detect cancers or inflammatory bowel disease or liver disease that's not detected on blood work, it's usually not great value. Now, if we see anything abnormal, or if the owners are especially worried, I got an owner that's had dogs that have had splenic cancer called hemangiosarcoma, so she does ultrasounds on the dogs every year just to be sure that's not there. It's not wrong to do, but it's not a routine recommendation because it's not that common that it warrants us doing it in every patient. Okay, another question, yes, wonderful.
What are the signs of electrolyte imbalance in dogs taking cardiac meds?
Okay, electrolyte imbalances, there's a few that can occur with these guys. Mostly it's the potassium. Some are going to be very deplete in potassium, so you have to give them potassium supplements. And sodium is another big one that we want to do sodium restriction and inhibit aldosterone. Sometimes they can have changes in their calcium as well, but that's not as common. The signs of these are very vague, and usually we detect them on a blood work, but the most common one is low potassium, and if that is present, then they have muscle weakness, okay? They can't use their muscles very well, so they
Just like we get
decreased
cramps.
strength, yeah, they have cramp, yeah. And a lot of times, it's called cervical ventriflexion, which means they have their head held down, and they can't pick it up. And that's one of the things that we see in these guys of muscle weakness with low potassium specifically, okay? Very
Now
good.
you mentioned sodium, like where should you be looking for sodium in the dog?
It's an ingredients, and when we do want to get them on a lower restricted sodium, we don't want to do it completely. We tell you how many, what to look for, which is the number, the cutoff, as far as so many millimoles per gram of food or something like that for it, guys, or so many millimoles per calorie or something like that. So we'll let you know the percentage to look for if we feel the need to do that. But it's in the list of ingredients that's required to be on all the dog bags and dog
I mean,
foods.
you know, you say it in human food, but I've never thought to look at it in dog food.
Right, right, exactly, yeah. Okay, any other questions? We'll get everybody all done? All right, if you have any more questions, feel free to email us and send them. I'll be happy to answer those for you. And 2 weeks again, we're going to be doing cat heart disease, because cat heart disease is very different than the dog heart disease, so we're going to spend a little bit more time just on it alone. So that'll be in 2 weeks. And if you have any other subjects you want me to talk about, feel free to email us, let us know, call us, because I'm doing this for you guys. I really enjoy doing this, and I have a lot of fun doing it. And the more we can meet your needs, I like to do that. So I don't want to just talk about what I know, because I know a lot, but I want to make sure I want to talk about what you guys are interested in as well. So let us know what you want to talk about, and I'll be sure to maybe get a presentation on it one of these days.
Thank you very much.
Thank
These
you
have been
very
incredibly
much.
informative.
Oh, thank you,
Incredibly
guys.
informative.
Wonderful. Have a good evening, and we'll see you in 2 weeks, hopefully.